This is All India Radio Pune broadcasting program on 378.78 meters.
Dr. Ulrich Randoll is the inventor of matrix therapy in the field of physiotherapy. This interview is taken by Dr. Sandeep Bhagwat.
Good evening, friends. We have Dr. Ulrich Randoll from Germany, Munich. Welcome, sir.
I'm very happy to be here in India again. So this is nearly my second home meanwhile.
Yes, sir. We learned that you are a medical doctor and you have a new concept for physiotherapist. We would like to learn more about the concept. Can you just elaborate us on the matrix concept?
Well, I will appreciate to do it. So it started already 20 years ago when I was working in the department of Maxillofacial Surgery as a surgeon at the University of Erlangen, and I dealt very much with chronic diseases. And I found out that we have only in our mind to treat structures. We have X-rays, NMRs, we are starting medicine with dead structures, with anatomy, but meanwhile I see the whole life as a process. And this is the big shift I did to turn reality from structure to process.
You are a medical doctor, and how do you turn to this structure to process?
Well, all the time, when you have failures in your doings, either you are working as a doctor or a painter or whatever it is, you have to think about, is the method that you are using the right one? And I asked, for example, when I have failures in my patients, do I have the right method and the wrong patient? Or maybe I have the wrong method and the patient needs something different.
Oh, that's really great. How can you explain the processes at the cell level?
Well, it was a journey in my life, When we are talking about symptoms in medicine and diseases in general, we are looking with our just macroscopical eyes to the system of we have X-ray, NMRs, and when we are going to the cell level, we are seeing dead cells. And then I saw that life, is always producing rhythms. That means we have heart rhythm, breathing rhythm, and here in the country you are measuring from the ancient times the Vata, Pitta, Kapha, and you have the different pulse equivalents for health. And this made me very much astonished that in 1,000 years ago, 2,000 years ago in India, you had the pulse as a measurement for diseases. And so we say in Western medicine, when there is no rhythm, we have no life anymore. So in my post, the only question, which rhythm is necessary to have a good life?
Rhythms estimate our life.
Rhythms estimate our life, and now of course you have to pose the question, who is producing these rhythms? And then I have the metaphor that the human body could be regarded like an aquarium where you have about 70 billions of cells in the aquarium, and they are like the fishes in this aquarium. And all these cells are surrounded from water. And so you have suddenly a processed system in front of your eyes and not just a cadaver or like in anatomy or in pathology. So you can see the body from the structural side and from the time side, that means from the rhythm side, and everything is together in such a model like in an aquarium. You have the single cells that they work more or less together, and they produce, for example, when you have the heart cells, they produce just the pulse that you measure in Vata, Pitta, Kapha on the wrist. But these three types of rhythm are produced by these single cells, and by coherence, by working together like the musicians in the orchestra, they produce this wonderful music of Vata, Pitta, Kapha. And when this sounds wonderfully, the Ayurvedic doctor says, well, he is in a positive sound and he has no problem. But when it is just derailed, then of course he says now he is this type or this type and he has to go to this diet or to this diet. That means you are always treating from this concept of Ayurveda, you are treating the whole aquarium, for example, just by nutrition. And in the field of physical therapy, you apply massage techniques. And then I went around and asked in Western medicine, what similarities do we have from this Ayurvedic concept? And then I went to physiotherapy. We have also people that are working with machines, electrical pulsations, magnetical pulsations, or just rhythmical massage techniques. So it is there, but it is just only a few people that use it. Most of the people, when they have pain, for example, they don't go anymore to massage techniques. They just go to the pharmacy and just take painkillers. And this is the standard nowadays. And of course, we all know that we have side effects from these painkillers.
So you have equipment to produce these rhythms, as you said. So how is it?
So this was first, the general thought I had to think in another way, that I was looking in the Western medicine what kind of principles do we use as they used in former times also in Chinese medicine. There you have the Tuina massage techniques. In India you have the Panchakarma concepts, And in Western medicine I found that we have the so-called spa tradition, hot water tradition, from the last 100 years, But nowadays, in our medical concepts, neither in India, nor in China, nor in Germany, I find just the praxis of such kind of traditions in a very wide range. Everything is reduced. You will find a small hotel offering here a little bit Ayurveda, here a little bit of this, here a little bit of this. But the huge concept was the standard medicine from thousands of years does not exist anymore. And this made me very much astonished. And so I tried to go to the principle of this kind of massage. What is such kind of vibrational massage, for example, you use in Ayurveda, and also when you go to yoga, you have vibrational aspects in your asanas. And then I asked, what is the physiological aspect behind these treatments or behind these exercises? And so I came to the shivering of the single cells. And then I saw in my very advanced high-tech microscope, where I could follow the movement of the cells like the fishes in the water, I could see that all these cells, move and also move the water around them. That means they cleanse always their environment. And that was just an awakening for me. That means when the environment of your body, of the society, when the street is poisoned, when the air is poisoned, when the nutrition is poisoned, then of course a single person is suffering, also the fish is suffering, and then you produce first symptoms, and at the end you will die. And so I saw that the treatment has to be started on the cellular level.
Oh, that's really great. It's a cellular approach, you mean to say?
Exactly. That means when you want to recover the society, in every country you have to start at the single person. And in the body, it's similar to the society. You have to start at the single cell.
Yes,
and
the fundamental unit of the body.
And this is the central unit of the body. And so I just analyzed what is the human body doing as vibrations or oscillations or rhythms. You have breathing rhythm, heart rhythm, brain rhythm, and also the shivering of your skeletal muscle. And now the main question is, when does your body start to shiver? Just reflect. Very easy. When you are freezing, for example, when the water is too cold, you go out, or in winter time when the oven is cold, you are freezing. Yes. And you are shivering. And the same happens when you have orthostatic collapse, when you have a heat shock and you are just falling down to the floor.
Yes.
The body is just lying there and it's shivering. Or when you are afraid, the body is shivering. And now the question, or when you have a weightlifter, for example, he is lifting the weight.
Yes.
And from a certain moment when it's getting too heavy, the body is shivering. The skeletal muscle is synchronizing and shivering. And you see this macroscopically. My question was, you have to always pose the right questions, otherwise you will never get answers. This is very important.
Yes.
Unfortunately, most people don't pose questions anymore, and so they don't receive any answer. So please pose questions all the time in your life, and in this case too. Why do we shiver? And then I saw that always in these extreme situations that I explained, the body is centralizing the liquids from the periphery back to the heart. That means by shivering, you centralize the lymphatic liquids and also the venous pathway back to the heart, and so the circulation is open for fresh blood from the heart side.
So rescue mechanism for the body?
It is a kind of rescue mechanism to make the body survive. That means that the cure of the self-healing of the body starts by opening the venous and the lymphatic drainage. And this was the key. because I saw in none of the Western medicine people thought about such kind of treatments. Of course, we have lymph drainage, but lymph drainage is not shivering in Western medicine.
Oh.
And so I had to think about this point. And then I developed a special machine called Matrix Mobile, a technical device, and I'm very happy that we have it now since 10 years also in India, at many places already, and people are very much satisfied, where I can simulate with this machine the body shivering, and that means it's now a treatment that is conformed to nature without any side effect, and the pain, back pain, knee pain, hip pain disappears immediately.
Oh, so nice. We have Dr. Harish Kumar from Chennai. He's a very famous physiotherapist from Chennai, and he has also joined us today. I heard that he's using your equipment for quite some time, maybe from 2017. Hello, welcome Harish.
Thank you, sir. Thank you for the warm welcome. I'm using Matrix Rhythm Therapy from 2017. It's almost 4 years I've completed. This is my 5th year. I'm giving good results in all the pain management cases, like wound ulcer cases and other systemic management. We are giving results. So we like to thank Dr. Randoll for this amazing concept for the mankind, which has changed the perception of how we handle the patient, how we handle the pain management. It is definitely God's gift for mankind.
So as a physiotherapist, you had other modalities of treatment.
Yes, sir.
And now you have Matrix. So how do you compare these?
The first and foremost is the other modalities, which is all we use it in a regular physiotherapy clinic, are all fixed frequencies. Say they work in particular intensity or particular duration, say around 15 minutes or 7 minutes or 10 minutes. But during that time, what we can do with the patient or the cell or the body, how we can manage the pain. But with Matrix concept, it is a longer period. It takes around 60 minutes because it needs time to heal the tissue. We need to spend time to the tissue. We need to spend time to relax the tissue because the muscles are contracted or tightened. That causes all these defects and all these lymphatic issues. So those things has to be relaxed, and which gives a major difference when we see it in a clinical case.
So what are the common conditions that you treat in your clinic?
I commonly treat is cervical spondylosis, neck pain, which is radiating to the upper limb. We have treated those cases. Shoulder pain, periarthritis, like diabetic patient.
Diabetes.
Nowadays I say as when a diabetic patient comes, shoulder stiffness, that is periarthritis, is a compliment for him. During his lifetime we will have once or in his shoulder, so that is one of the common problem. Then we treat tennis elbow, then hand grip deficiency, post-surgical.
You treat ulcers also with this equipment?
Yes, sir. With this equipment we can treat diabetic ulcers, pressure ulcers, venous insufficiency, which are all not possible or not in the spectrum of a physiotherapist.
Oh, really?
After this, it has improved our spectrum of practice for physiotherapists.
To broaden the horizon.
Yes, sir. It is improved, and our main criteria is we should not prescribe medicine. We still stand in that same boundary. We treat it, automatically the wound heals because oxygen is reduced to the end wound ulcers. Once we increase the oxygen and reduce the contraction, the wound automatically heals.
Yeah.
So we still stick with our boundaries.
Okay.